Hey, so today I'm going to talk about a very special compound in garlic. To pronounce this, let's bring Marie, since you're from Mexico, right? So it's not Ajoene, it's Ajoene?
No, it's ajo.
Ajoene, okay.
No, not ajoene.
Well, that's the compound.
Okay.
Because we're talking about this right here.
Yeah.
That's the Spanish word, that's where it comes from. Yeah.
Yeah.
Okay, garlic, right?
Sí.
It's not ajo, it's ajo.
Ajo.
Silent.
Mm-hmm.
Okay, good. Thank you very much.
Thanks.
So it's Ajoene, okay? So what is so special about this sulfur-based compound? Well, Big Pharma is putting a lot of money into it right now to try to find a way to patent it because of its powerful blood-thinning anti-clotting factors, especially when you're dealing with decreasing the risk of stroke. But it also has other properties as well. It decreases risk for tumors, viruses, but not just viruses, antibacterial, anti-yeast, anti-candida. It will also decrease the risk of respiratory infections, especially if they're fungal. And on top of that, it has the potential to decrease risk of certain types of tumors of the brain called glioblastomas. So this compound and many other phytonutrients are activated when you crush the garlic. So if you have a higher risk of getting a stroke or you already had a stroke and you don't want to wait for Big Pharma to come up with their patented formula, well, guess what? Start consuming garlic. It just might help you. So I want to thank you for being here and watching my videos. If you haven't already subscribed, go ahead and do so you can stay informed of future videos.